Let's get more on this now with Einar Tangen. He's a China analyst and he joins us from Beijing. Good to have you back on the program, Einar. China locked down Shenyang, a city of 9 million people, overnight as the nation's zero COVID strategy is confronted by an Omicron wave. Is this strategy still effective more than 2 years on from the pandemic?
Yes, largely it is. I mean, if you start looking at the death tolls and things like that, when you have one death over a period of many months, almost a year, I mean, that is pretty effective. When you say 20,000 cases, when they were spread out over a number of weeks as opposed to days. I mean, Hong Kong was experiencing 30,000 a day. They're still going up. And, your reporter is right. China is not willing to risk what's happening in Hong Kong on the mainland. Now, in terms of zero COVID strategy, that is not something that's set in stone. China has, for the longest period of time, said that they have targets. They want to hit 85% in vaccinations. They've now hit 90%. And they want the mortality of the strain to go down below 0.1%. So it's equivalent to the flu. At that point, they can switch from a pandemic to an endemic situation where they, in essence, what other people say, are living with it. But they don't want to repeat the mistakes that have happened throughout the world through poor leadership, through choosing politics rather than science.
Yes, but even countries like Australia and New Zealand, which had also sought to eliminate COVID, realised that they were really fighting a losing battle. They've now relaxed their elimination strategies, saying that it was no longer a realistic approach. Do you think Beijing should be following a similar example and perhaps learn to live with the virus as opposed to eliminate it?
Well, I mean, China is, in fact, changing its strategies. They do far less, massive lockdowns. They're for shorter periods. They're using these bubble strategies that allow places like Foxconn to continue working. This is a gradual, not relaxing, but responding to the pandemic as it evolves. In terms of these other countries, I mean, the facts speak for themselves. China has had 10.3% growth over the last couple of years. I don't think that they have suffered anything in terms of economically, not as bad as the rest of the world. So when you have a world-leading case, this kind of idea that China should regress to the mean and suffer along with the rest of us doesn't sound very rational.
In terms of the vaccination rates in China, it's been found that elderly residents have actually perhaps not being vaccinated. I think a figure that was bandied about was about 50% of elderly Chinese vaccinated. Why is that the case? Should the government be doing more to increase vaccination rates among the vulnerable, like the elderly?
Well, I don't know exactly where you get those figures from. I mean, the figures that I've seen from China itself have been that they have 90% vaccination rates, and the areas that are more difficult to reach are in rural areas and where there are quite a few elderly, but nowhere near a number that would represent 50%.
Okay, so you're confident that the majority of the population in China are actually vaccinated?
Yes. No. I mean, if you were here, you'd understand. I mean, you can walk down to the hospital. They'll give it to you for free. They'll give you supplementaries for free. I thought that as a foreigner that I would have to pay. I was simply informed that, here are some hospitals you can go to. I went there, I received the jab. I said, can I pay? And they said, no, it's not. It's free. And the same thing with PCR tests. These are all considered public health necessities. And so they're being offered free to those who need it, and even those like myself who don't.
Okay, Einar Tangen.
I mean, in terms of paying.
Yes, we'll have to leave it there, but thank you as always for joining us on TRT World.